So in Connecticut, we've been working for more than 10 years now on improving services for children who've experienced trauma by training behavioral health clinicians, child welfare staff, and others who work with children and families, improving screening, improving access to evidence-based practices. But a lot of that work has more emphasized children who are older than 6 or 7. And so over the past couple of years, we've really shifted our attention to try to do more for the youngest children. So the impact report was written to summarize where we are in Connecticut, what's been done already in terms of trauma-informed services for young children, and then also to develop recommendations and next steps for improving this work in the future.
So the Early Childhood Trauma Collaborative is a 5-year federal grant through SAMHSA and the NCTSN that CHDI has. And really the ultimate goal is to increase the number of very young children, children under 7, that are receiving an evidence-based practice that is trauma-informed. So really thinking about the child and the family at the center and recognizing that in early childhood there's a number of different systems that they'll be interacting with. So some of those are early care and education, pediatric primary care, early intervention and family support services, child welfare, and infant and early childhood mental health. And so really thinking across these settings, how we can make them more trauma-informed, we really built it around 4 key elements, which is workforce development, so everyone in those systems knowing the signs and symptoms of trauma, screening for trauma, having regular routine screening, practice change in the use of evidence-based practices in those systems, and then finally the collaboration and communication across all of those systems.
So there's more and more research coming out just that trauma does impact young children and impacts them across a number of different contexts, so that trauma may impact children in the preschool setting, and that trauma may impact children's health or them on kind of a physiological level, so their stress response hormones. And there's also research coming out that trauma can impact children in their attachment relationships. One of the important things I think that's coming out in research is longitudinal research, so looking at children who experience trauma early in life and how that impacts them kind of throughout their lifespan. And so that really helps to highlight how important it is to think about early childhood trauma, because if we can intervene early, then we're perhaps preventing or just lessening the impact throughout a child's lifespan. So anyone who is working with young children and their families or making decisions that impact young children and their families should read this report, because it really offers kind of a blueprint or a framework for how to understand the impact of trauma and how to address trauma within these early childhood systems.